Dear colleagues, I am trying to share one very special case history. My friend's son, who is 36-year-old, he called me with a complaint of shortness of breath. This happened a couple of months ago, which is not able to breathe properly after climbing steps, after doing some heavy work. As usual, because he is somewhere in Nellore district, I am in Hyderabad, I told him, go and meet one physician or some doctor at least, get your lungs examined, you may be having some asthma. But to my surprise, the local doctor cleared him that he is fine, and he continued with some small medication. But what happened afterwards? After 2-3 weeks, he called me again from Nellore. This boy has no risk factor for any heart disease. No obesity, no hypertension, no diabetes, no smoking or alcohol habit, reasonably good quality of life, little bit of stress, of course, nowadays everybody suffers from. His complaint was this time inability to go to toilet and get up without breathlessness. Can you imagine? Young boy of 37 years is not able to get up from his toilet without feeling breathless. Then when he called me, I told him immediately you go to a senior physician or hospital, because we are all aware that shortness of breath is one of the important signs of heart attack. Luckily there was a young dynamic cardiologist in that hospital who examined it, took his ECG and conveyed there are some changes. So immediately he did an angiogram. Then he found huge thrombus in his pulmonary vessels. Can you imagine? So the boy was suffering from a thromboembolism. Almost a couple of centimeters long blood clot was in the pulmonary vessels. This is very, very serious. No wonder he was having a shortness of breath. Probably he would have been dead in 1 or 2 weeks if no treatment is offered to him. Luckily, the cardiologist did a thrombolysis by suitable medications. That boy is doing well now, almost 3 to 4 months over. But what is the cause for this? And what is the cause for those people who are without any cardiac risk factors dying in the gymnasiums, grounds, and while playing, while doing their job? What is the cause? I have 2 signals in my mind. One is COVID, post-COVID complications, because we saw in many sportsmen in US, especially footballers, basketballers, who recovered completely from COVID, and they did have cardiac problems after a couple of months while playing serious games. There are fatalities among the sports persons who played these intensive games after COVID. Second is COVID vaccination. I don't know. I am not aware. But there's only 2 things happened. Either COVID or COVID vaccination. Or any new thing which is killing these young people. So I appeal to medical fraternity, senior doctors. Please be little vigilant. 25 to 40 population. If there is a chance, definitely investigate their pulmonary vessels and do thorough 2D echocardiograms. Don't miss out on young people. Thank you for patient listening. This is an eye-opener to prevent deaths in this young population. This case study clearly demonstrates there are no other serious reason for cardiac death. But what is that? We need to really explore.